there is a mutant virus going there or traveling around, which is called now the Indian variant, which seems to be much more infectious, but you don't see a mortality increase that is exponentially following the same line as the infections. The infections are really going steeply up, but the mortality rate isn't going steeply up. They lose about 2,000 people a day on a country of 1.3 billion people. But the infection rate is enormous, which is, in my opinion, good news.
Hi, I'm George.
And I'm Tim.
And welcome to This Immunity Podcast.
On this podcast, we are joined by Sam Brokken. I hope I pronounced it correctly. Brokken, is that okay? Perfect. Who's a public health expert.
And he focuses on science-based medicine and health research. And he was a lecturer at PXL University in Belgium. Do I say that correctly, Sam? Okay.
Well, thank you very much for agreeing to do this interview with us. We are very interested in what you have to say today. And we have a lot of questions, but they will be very easy to answer, so don't get intimidated. Okay, so from what we understand, you were invited a while back to speak on a national television show about vaccine policy. Is that right? Yeah? Yes, and as we understand, that was not without consequence. You pretty much, could you tell us why you were invited to speak on that show specifically?
That's an interesting question because we have been working together with about 20 people here in Belgium, virologists, infectiologists, immunologists, psychologists, a team of about 20 people, and we have been trying to put forward some policy recommendations, alternative policy recommendations, but we were always banned from mainstream media. So nobody wanted to do an interview with us. We weren't invited to any public debate or any television debate for that matter. What happened was I wrote a letter which is called Omgekeerde Lockdown or Reversed Lockdown in English in August 2020. And what I proposed is the same thing that the Great Barrington Declaration proposed in October 2020. And it was co-signed by 1,500 professors, lecturers, scientists, and medical doctors. All from Belgium, who agreed with my approach or my alternative. But then we had some media attention, but it was mostly based on the fact that we were disseminated, that they were putting us backwards as anti-vaxxers, and so we didn't get into the mainstream media as a person. So what happened was that 6 weeks ago, there was an interview with a Dutch professor called Ewald Engelen, who co-signed my open letter in August. And he was interviewed by a mainstream magazine here, a very big one in Belgium, called Humo. And he proposed in the interview that the only solution to get out of this crisis was the reversed lockdown or focused protection. Suddenly, a week later, in another big magazine, we have here another professor, Professor Gert de Meerleer, who is an oncologist from the University of Leuven, said the same thing in the interview, and he said the only way to get out of this crisis is reverse protection or reversed lockdown. So suddenly, it started circulating in mainstream media. And the same week, I was called by an actor, a very famous Belgian actor, who was asked to do an interview for another big magazine. And he called me and he said, look, I've been following you for a couple of months and I totally agree with your approach. I want some feedback data, correct scientific data, so I can prepare myself for the interview. And he stated in this interview, the only solution is a reverse protection as an alternative. And then the next day, he was on every cover of every magazine, every newspaper, on every television station, and he was put aside as a total lunatic. He and his wife were put in the camp of the anti-vaxxing people, which they aren't. They just have concerns like I do as well. And he was so depressed of what happened that he gave a call to one of his friends at the national television station and said, "Look, this can't continue like this. You know, we are all being banned. We are all being ridiculized. We are all being disseminated. There's something that has to change. Give the guy the possibility, give Sam Brokken the possibility to join the national television debate." So she basically put her head on the shelf. She had to negotiate, I think, for a week to get the television station to comply, which they finally did. The first thing that happened was that they called me and they said, "You can go into a discussion, in a debate, a direct debate with a professor called Professor Van Damme, which is one of the leading experts here on the virology case." And I said, "Okay, that's good. If I get 20 minutes or a quarter of an hour personal debate, it would be the first time for us to be able to bring forward our narrative, our alternative in the mainstream media." So I said, I want some time to explain this because all the experts have been on television without any counter argument for a year now. So they have been proposing anything they want without being questioned. Suddenly they came back and they said, "No, we will have 6 people on the table." I said, "I don't agree." Then I bail out. Then they came up with the proposal for 4 people, and I said, "Okay, but I need 25 minutes." What we did was we discussed 5 teams that we would discuss, and we agreed upon that. And then okay, I got invited. I was on the television show, was live, broadcasted live. And what happened was, at the 3rd team, we started discussing transmission. What's the possibility after getting vaccinated to transmit the disease to another, to a third party? And I said, there is no proof that a vaccine will help or prevent transmission. On which the professor said, "Oh yes, there is. There is proof now from an Israeli study that if you get vaccinated, 12 days later, you won't be able to transmit the virus." And I was totally flabbergasted because I've been following these science updates every day since more than a year. Okay, I can miss out on something because there's being published so much the last few months that. So I said to him, "Okay, show me the article." And what happened was that half a minute later, the interview was ended abruptly. We only reached about 30 minutes instead of the promised 25, and the total debate was over. And I counted it. Talked for just 1 minute and 49 seconds.
Have you received an answer since then? Because you said you wanted to see the article. Have you seen any such article?
I didn't get to see it during the debate, and so the debate was ended after 13 minutes instead of 25. The last 2 teams in which I should have been talking about a potential alternative to get out of the situation didn't even get in the broadcast. So later on in the green room, I asked the professor, "Where's the paper?" And he said, "I don't have it with me." And I said, "Who wrote the paper?" "I don't remember." I said, "Here's my email address, send it to me." And I never got it. So 2 days later, a colleague of his sent the paper to me, and there was absolutely no proof that there was a stop in transmission. There was a very slight difference between vaccinated people and non-vaccinated people. In the case that vaccinated people had slightly less viral load, slightly less, capability of transmitting the virus, but still it was an enormous amount. So what he was telling me was totally untrue and baseless. So what happened was that the same afternoon of the broadcast, the professor was contacted by the media, and what he said, he reflected on the debate, and he basically put me aside as an anti-vaxxer, which I am not, because I even stated in the broadcast it should be a double-up intervention. Vaccinate the elderly and people with underlying diseases is ethically responsible. But knowing that between 80 and 90% of the population that gets infected hardly ever reaches a very severe state of disease, most of them are just mild diseases or even no symptoms at all, it's ethically irresponsible to start vaccinating the young and healthy population that is totally well abstained from getting this severe COVID disease. But I was put aside as an anti-vaxxer. The next day, I was all over the newspapers, all over the news, and finally, my university college kicked me out. Yeah.
So Sam, what you just said, that's actually quite a sad story. But in regards to the vaccinating of the general public, like you just said, you said it's irresponsible. Some people would have they say that if you vaccinate the younger people, that would indirectly also protect the older people. Would you agree with that?
No, but it's not, because it's not true. There is no biomedical substantiated evidence that this will be the case. It's not because even if you're vaccinated, you are still able to transmit the disease. If you're not vaccinated, you're also able to transmit the disease if you're symptomatic. We also know that if you're asymptomatic and you don't have any symptoms and you have the disease, you can hardly infect someone else. So there is no biomedical substantiated evidence that supports the thesis that a vaccine will prevent you from transmitting to others. So there is no use in vaccinating younger people to protect the elderly. No, you have to protect on an individual level. So if you have underlying diseases, or you are prone to get the infection and have a high risk on mortality, then it's quite ethically responsible to say, okay, we suggest a vaccine. But now it's being promoted as you have to vaccinate yourself to protect others. This is utter bullshit.
Okay, so what do you think, Sam, is the reason for the current, well, let's call it the COVID vaccine policy? You have any idea?
That's a very, very long discourse. If we want to dig into that, it all started changing in April 2020. The first 3-4 months, the experts were following science. They said mouth masks or face masks are useless. They said the only thing that helps is keep a bit of a distance, wash your hands, and that's about it. That's the only way to keep the transmissions on a low level. Suddenly it started to change in April 2020 when we saw that there was geopolitical influence starting to play upon this part. And certainly knowing that from the summer on, all the countries were shouting, yeah, the vaccines we are going to put all our efforts into developing vaccines. You saw the WHO shifting his narrative, which was quite remarkable. And it's not an independent organization. It claims to be, but let's be honest, it's with everything is politicized. The UN, EMF, World Bank, we have to take that into account. The World Health Organization needs the funding of countries, needs funding of philanthropic organizations to keep its activities going, which is in normal courses ethically totally responsible. But what we saw happening was that, and we already know, this is not a big secret, that the Bill and Melinda Gates Foundation was the number 2 sponsor of the WHO. Gavi Alliance also liaised to Bill Gates, was number 6. So basically Bill Gates was on number 1, number 2, number 6. And we all know he has, through all the kinds of hedge funds, he has a big part in basically all the pharmaceutical companies. So you can't prove that there is a causality, but there is certainly a correlation between what was happening and the timeline we saw. So there is, myself and the team all think that there has been a kind of vaccine push towards the WHO as the sole alternative to get out of this crisis, which is, in my opinion, quite a risky game. And the reason why is because if it's ethically responsible vaccinating, as I said before, the people with underlying diseases. And the reverse protection, the basis of the reverse protection is to create herd immunity within the healthy population. And the reason why is because it's much faster than trying to vaccinate everyone. Vaccinations cost a lot of logistics problems, a lot of money, and we have to be honest, we don't know what the midterm and the long-term consequences are of these vaccines. So even if you decide that it's ethically correct to vaccinate people with an underlying disease, it's better for the 70% of the other population to give them the opportunity to gain the infection, to create their own individual immunity, and then you are contracted by the latest mutant. What we see now happening is that the vaccines that are on the market have been made and created based upon the genetical structure of the virus from 8 months ago. We now today see in publications in The Lancet and Nature Medicine that the vaccines have a vaccine efficacy of 0% up to 50%, depending on who gets it. So it isn't a 95% vaccine efficacy like they told everyone. The reality is we are facing a very a vaccine that in some cases is even missing out on the mutants. So this is not the best strategy because you will keep running behind. You always be behind the problem. You will be constantly chasing the problem. If you do it on a natural way and to try to create natural herd immunity, you will always have the latest virus that infects you. So your immune system always it's like an update of a computer. Every time you do an update, you get a boost and everything starts running again. And then you are contaminated with the last mutant. So your immune system is up to date. And you can't reach this form of immunity with a vaccine. And the risk we see now, also evidence-based in literature, it's already published. There are 2 big main concerns: antibody-dependent enhancement and immune escape. And these 2 have been published now, 2 articles in Cell Biology and Cell Microbiology, and 1 in The Lancet and 1 in the New England Journal of Medicine, already discussed the fact that if people with underlying diseases are being vaccinated, those people already have a problem in creating a good immune response. Secondly, we know that the vaccines aren't that efficient anymore. They are in between 0 and 50% efficacy. So what happens is that the people with underlying diseases getting a vaccine will not have sufficient immune response or develop enough antibodies to be resistant against, certainly not against, the mutants. And we already have 7,000 mutants since the beginning of the crisis.
So, Sam, I'm sorry, Sam. So what you're saying is that for people with underlying diseases, the vaccine will work even less well in comparison to healthy people.
Yes.
Right.
And it might be counterproductive as well, because if they get infected, and that's what the studies also claim now, that they call it antibody neutralization. If they get infected with a recent mutant, their immune system starts overreacting, and this may lead them to, in the worst case, to die, and in the best scenario, they develop the illness quite severely, and they become super spreaders for the people around them. So the main question is, why don't the experts that are in charge in every country abstain from following the most recent scientific based data? Why don't they follow the newest insights we gain? And why do they stick to the paradigm that they have kept going on for a year and a half now? Why do they stick to the fear-based narrative, knowing that the vaccines aren't the big solution? They can add to the solution where they won't solve the problem.
Do you think do you have any ideas yourself what the reason could be why certain scientists are not speaking out?
I think it's a very complex issue. If we start looking back, and we look back at the beginning of the crisis, what happened was governments didn't want to. First of all, let's start from the beginning. What happened was December 31st, 2019, China said for the first time, send a letter to the WHO telling them, we have something going on here which we can't explain. We have reached a new virus that we can't comprehend at this time. It was 31st of December, New Year's Eve. So there was no news in the world. Everyone was in New Year's Eve mode or Christmas mode. So there was basically no news internationally. What happened was, 7th of January, the WHO for the first time sent out a press release and said, there is a new virus coming from Wuhan, China, and we don't know what it is. So what happened was the total world press, because there wasn't any big news at that time, wasn't a big war going on, or was anything decent in the media. I saw the press jumping onto this fact. And within a week, it was news from Vanuatu to the North Pole. And this was unseen. I never saw this before. We didn't see this kind of media coverage with SARS. We didn't see it with MERS. We didn't see it with any other, with Nipah. We didn't see it with any other outbreak. It was the first time that the coverage in 2 weeks' time was so huge that I think that's part of what the problem started, when the problem started. So government started to get into some kind of panic state. And what did they do? They took the well-known experts. Every country has a well-known expert. So they started pulling those experts upwards, and they said, okay, now it's your game. We're a government. We don't know how to handle the crisis. It's up to you. Now, the thing is that the most well-known experts in countries are mostly the people who work at big universities, have a lot of PhD students, have a lot of postdoctoral students or postdoctoral researchers. And we all know that the academic field is being sponsored by philanthropic organizations. The same was in my department. We need this money to do research. So what has been a gray zone for the last 50 years, since the governments decided not to support research anymore, or not that much, philanthropic organizations and pharmaceutical industries have started sponsoring universities, which is okay. It's a gray zone, but we need the money to do research. And what we saw happening now is that the experts in every country that came above water to help solve the crisis were people that have been getting a lot of sponsoring from pharmaceutical companies in the past, also from the Bill and Melinda Gates Foundation. So you can't deny that there is an intertwine between all those people and the organization sponsoring them.
Mm.
And then you saw the shift in April. In March, what basically happened there was that the Ferguson projection came from Professor Ferguson from the Imperial College, projecting 40 million deaths. So that was the perfect. That was a perfect fear-based mongering to start upon, because all the world got in a total cramp and said, "Okay, this is serious business. We're all gonna die." So the narrative, the fear-based narrative, was already running for 3 months. Then the Ferguson projection came, and that was the deadlash for everyone. And then you see the experts starting to change their official first discourse, which was basically scientifically based, and said, "Okay, mouth masks don't work. Keep your keep everything. Keep it to washing your hands, sneezing your elbow. Those are very common, practical, and very good solutions." And then it started shifting. Suddenly, we needed to wear face masks. There is no decent evidence to support wearing face masks at all.
So Sam, what is the current I mean, a lot of guidelines, they recommend wearing face masks now. So what is it based upon? What is this evidence exactly?
There is no such evidence. All the observational studies we have, and recently Denmark a few months ago because it's an ethical problem now to do a randomized controlled trial. It's an ethical problem now, because if you demand from everyone to wear a face mask, you can't get an ethical approval to say, "Okay, I'll take 2 groups of people wearing face masks, people not wearing face masks." You won't get the ethical approval, because all the states, all countries are imposing the face masks. So you won't get the ethical approval. The only country we had who had the opportunity to do so was Denmark. And they took 6,000 people. They divided them into groups. And they put them back to society. And they did blood tests before and blood tests after the research. And what happened to 3,000 people wearing face masks and the 3,000 people wearing no face masks, circulating amongst all the others, at just the same infection fatality rate, did just have the same percentage of diseases. So their conclusion and other observational studies conclude that wearing a face mask outdoors is totally useless. The only indoors, it's also useless, because if your face mask isn't hermetically sealed, you still have to breathe. Air still comes in, your expiration goes out as well. And in a closed environment, if everybody is working in an office and someone has some symptoms and has COVID or SARS and is wearing a face mask, he still has to expire. So this will circulate in the environment, in the closed space. And we know that the aerosols can live in between half an hour and 2 hours in plain air. So the person sitting 3 meters from you with a face mask still has to inhale. So if the cloud of aerosols reaches him and he still has to inhale, he can get infected. So basically, face masks are not that efficient. It can contribute. In the sole case that researchers defined was if you are outdoors and you are symptomatic and you want to go out yourself and you wear a face mask outdoors, then and you have to sneeze or cough. This will prevent people in your direct environment, to protect them. So that's the only what's the only point of wearing a face mask outdoors if you're infected yourself. But it's with all kinds of guidelines. In the meantime, we have so many studies that have proven in the meantime that strict countries that were put under strict measures and lockdown, had the highest rates of mortality. And still we continue to sustain with this model, knowing that those countries who sustain with strict measures and lockdowns create the most collateral damage and have, relatively speaking, the highest mortality. Belgium is a clear example. The relative death rate we have for a country of 11 million and a half people, we have almost 24,000 people that died from COVID, and we have been restricted since a year and a half in basically everything.
Do you personally wear a mask, or do you refuse to do that?
Well, yes, I do, and not because it helps, but I'm not willing to sponsor the state. I have to pay $250 every time I'm not wearing a face mask. So what will I do? Spend my wage? Well, I don't have a wage anymore now, but spend my wage on paying fines. So they basically force you to do so. It's impossible. And also, you can't forget that about 85% of the people truly believe that the current measures are necessary to counter the crisis. Although we have been doing these measures for a year and a half and nothing improves, but people still believe. So if I go out without a face mask and I enter a shop, I will be killed instantly by 10 people who are so scared that I will infect them or kill them, so they will kill me. So it's basically very simple. Social pressure, financial pressure, repression from the government, so everybody complies.
So, Sam, now you mentioned that pressure. Have you also noticed that there's a lot of pressure on journalists? Because there's a very one-sided message being portrayed in the media.
Yes, it's very simple.
Yeah.
I know four journalists myself who have who have stopped working. One of them worked for a big newspaper for 11 years, and she said, "I can't bear this anymore." And she bailed out. She said, ethically speaking, I can't go on like this. We are not able to bring the truth forward. If we want to do a critical article, we are told not to. Last week, I had a meeting with a few international professors who have, are very well known. In the meantime, I'm not going to mention their names. And there was one BBC journalist who also attended the meeting. And he said, literally, we got an Ofcom, which stands for official communication. We got an Ofcom, and we're not entitled to bring forward an alternative vision. Wow. So it's what we see all over the world, and I don't think it's a big of a surprise, because all the media, the mainstream media, if you take it back to where the money comes from, or where the money goes to the same hedge funds for Europe, basically all the media companies are controlled by Bertelsmann. And we see it in, I never saw the proof, but the journalists who dismissed themselves from their jobs told me that the chief editors, as well in TV as in newspaper media, got a letter in the beginning of the first wave from the government telling them not to allow dissident voices into the public debate. So yeah.
So free speech is being hindered then.
Yeah, I think this is such an important message to share, because I'm pretty sure that most people actually are not aware of the pressure that happens in the media. And I do know that in social media, it's also going on. And the other day I've seen a simple message like the infection fatality rate of the WHO, when they just came out, it's 0.23. Somebody posted that, and also with the efficacy rate you mentioned earlier of vaccines, there was just a regular message and it was blocked. I don't, and I see this. It's getting a trend. I don't know if you have noticed that on social media in particular.
I've been blocked from LinkedIn. I posted 2 analyses. One analysis was about 800 words, and I substantiated it with 56 scientific articles. And it was blocked by LinkedIn, and I got a warning. The second time I did it, I got a warning again with another analysis that I put forward. Then I gave up, and I just mentioned my site, the name of my site, on LinkedIn, and I said to the people, look, if you want to see my analysis, I don't post them here anymore because I get blocked.
Mm-hmm.
Go to my site. Well, even that message was blocked.
Okay, so it's very hard for you now to get your message out.
We can't.
Yeah.
It's very difficult to make a decent analysis, put it forward, and with references. It's extremely difficult. So everything is being watched. Yeah.
Sam, so regarding social media, especially Facebook, for example, they often make use of independent fact checkers, right? So what is your opinion on that? I don't know the source of their fact checkers. How reliable is it?
Well, it isn't. We have in Belgium we have an own fact check entity, and what the fact checkers consist out of journalists from the mainstream media, supported by the experts who are in charge. You know, they are the judge themselves. So how can you deal with that? If I bring forward an alternative, the fact checkers go to the experts and say, is it correct what he says? Of course it's not correct what I say, otherwise they will shoot in their own foot. So
you mentioned something about LinkedIn and you being blocked. Well, speaking of LinkedIn, you know that it's owned by Microsoft, right? So they bought it a while back. So what do you think is the role and influence of Bill Gates, specifically, like, you know, on the narrative, on the COVID narrative? What do you think he has to gain from this?
I think as I said before, I can't prove the causality between all this, but you must be blind not to see the correlation.
Okay.
So, Sam, regarding, because I mean, the pandemic measures, they've had a very strong impact on society. Like for people that don't realize what is the collateral damage and how far it reaches, could you share a little bit more about that?
Yeah, let's start with a small study I worked upon with a few other colleagues when I was still working officially, and other colleagues from other universities. We made an analysis, a risk-benefit and a cost-benefit analysis solely for Belgium. It's a small example. And we looked at the first 57 days of the first wave total lockdown. And we looked into psychological, psychosocial, mental well-being of the population. And we came to the conclusion that within the 57 days, we lost 77,000 healthy life years. And it would cost our government 4.3 billion euros just to set in course psychological support for the rising amount of anxiety, depressions, post-traumatic stress syndrome, etc. That's just a very small example. In the meantime, we have international studies have been published in Nature and the Lancet last month, looking in the mental state of the worldwide population. And certainly within the youth and adolescents, we see a rise of approximately 50% in anxiety disorders, mental stress, post-traumatic stress syndrome, and 38% rise in suicide attempts under 25.
I've recently seen, I don't know how accurate it was because I can't recall it clearly, but I think I've seen the suicide rates of adolescents was actually, the deaths coming from suicides was actually higher than the infection caused by COVID. Do you know anything about that?
That's what we assume. Yes,
Yeah,
at this point in time, that's what we assume. Yeah,
right.
and it doesn't look good because and that's what worries me the most. I have children myself. My son is 18. My daughter is 17, and I see my daughter gliding away uh, mentally for the last year.
Mm,
She can't. She let's say that every form of um, resilience is gone. I went out with her about 3 weeks ago. We went into the city, face masks on, social distancing, all the rules, just to get her out of our little bubble she's in. And after 20 minutes, my son said to me, "Look at your at Emma, which is my daughter," and she was just frozen on the floor, and she couldn't move anymore, and she was pale white. And I asked what happens, and she said, "I want to go home now. I can't bear being in an open environment." So she was developing agoraphobia, fear of coming into open places. So I
mm,
had to put her in the car and drive back home. So what we are doing, you have to know, in an adolescent age, neurological, in your brain, you are making, during your puberty, you are creating a lot of neural networks. And those neural networks in your limbical system are the systems that create your social patterns for the rest of your life. And when you're 15, 16, 17, you should be able to go out, have a date, kiss your first girlfriend or boyfriend. That's the start of developing social relationships, developing of learning what socially works and doesn't work. And all these things are being taken away from the youth now. So I project within 20 years, we will have a huge amount of mental issues once these people, these youngsters now, in 20 years, are adults of 40 years. I think we will see a lot of psychotic behavior. We will see a lot of
Fear.
fear, schizophrenic fear, bipolarity. We will see enormous rises. The influence that this has on kids now is detrimental for the future. Even more, there has been a study now, published also in last month, looking at little babies. So most governments enforce wearing face masks for parents when their baby is born. So what researchers did was look after 8 months to a year, look at the babies and see how they respond to the natural face of their parents. So when the parents take off the face mask, the children are in total distress because they are unable to recognize the face of their own parents. They don't have any mimical connection anymore. You have a mimic like smiling, being happy, being sad. Babies from 0 to 1 year old are unable to communicate. The only way to communicate for them is by crying, being happy, and they also have to learn to recognize this from their parents. They don't recognize this anymore.
So what you're saying about teenagers and forming neural networks, that's one thing, but like we're talking about the smallest life form here. And so their brains, they even need to develop more than teenagers. So like I have no idea what the consequences of that in the
I don't want
future
to
will
think
be.
about it. Yes.
Yeah,
So this is just a mental part. Oxfam did a study projecting 360 million youngsters in the world will come into poverty in the next year, amongst which 20 million will probably die of hunger.
oh,
So I'm not sure where we're heading with this crisis or what. This is complete insanity. If you look at a worldwide level, we have reached 3 million COVID deaths. Those are the official numbers. Just to give you an idea, 57% of the Belgian COVID deaths are probable COVID deaths. They have never been tested on COVID. They are being written away as COVID. So I guess worldwide, a lot of people who died have been written away in the data as COVID patients without having been died for as a COVID. You know, we have some small case studies here in Belgium, ranging from 28% to 66% of the people being admitted to hospital deceased on a COVID department that didn't die from COVID but from their underlying diseases. So if you take this into account, let's say 25% worldwide wasn't a real COVID case. From the 3 million, it diminishes like hell. So we lose about 65 million people a year, mostly on cardiovascular, diabetic, or other lifestyle diseases that are induced by our environment in which we live. Cars, NOx emissions from cars, processed food we eat, junk food we eat, Coca-Cola we drink. The thing is, societal, the main question is, what do we want as a society? Do we want to try to obtain a zero risk, or are we still able to cope with life? Are we still able to cope with death? And are we still able to see death as part of life? Because if we want to be consequent and you want to crush the virus, which we can't do at all, this will remain amongst us, become endemical like influenza. But if this is a societal debate we have to really put forward, because if we want to be consequent, then we have to stop McDonald's, then we have to stop all the producers of processed food, which develops cancer in people. You should ban all cigarettes out of the world. You have to stop driving cars, motorcycles that pollute the air, of which we get lung diseases. So if we are 65 million people a year die of these diseases. So are we going to do that as well? Are we that consequent that we do this as well?
Yeah.
Or or do we take the collateral damage as a part of life that's just part of our society, and we just know that this happens and we all bear some kind of risk? We can cross the street and get run over. Are we willing to still accept that risk?
Sam, now you're raising a very interesting point, because your background is in public health. So the fact that the risk of dying from chronic disease, for example, or as they call non-communicable disease, is so much greater than dying from COVID, yet for some reason, COVID is getting a lot more attention. Right. So how do you feel with your background? What we can do about that? Why is COVID getting that much more attention? And chronic disease, and paradoxically, chronic disease makes COVID symptoms, the progression of the disease, also worse, which is kind of ironic in a way.
Paradoxically so, yes.
Yeah.
Yeah, well, that's the basic question, huh? And then we come back, I think, to the geopolitical forces at play now. You know, the pharma industry. What I know from Europe, I don't know about all the other continents in the world, but Europe paid a huge amount of money to the pharma industry in the summer of 2020 to help speed up the process of developing vaccines. So there is a huge intertwine between the money spent from the EU towards the pharma industry. Pharma industry had to deliver. Vaccines are coming. The CEO of Pfizer 2 weeks ago announced himself that we're going for the third vaccine round based on a new mutant gene. So they are already preparing all the world leaders. We are going to develop a new vaccine, so be ready for the next one. So the geopolitical influence is so huge, and the pharmaceutical lobby is so huge, and governments are in total fear. So they think vaccines will be the solution, which they will never be. So we are stuck in a kind of totally fear-based paradigm, and that's the reason why we focus so much on this. People also start looking through a very small angle if they have fear. If people have anxieties, depressions, or have fear, they tend to forget to look in a contextual manner. They lose a helicopter view and basically end up just looking at the exit. And the exit that is proposed is the vaccine, but it will never solve the problem. It's the same thing with the green pass or vaccination passport they want to imply here in the EU. There is no biomedical justification to have a vaccine passport. Biomedically, there is no justification. First of all, let's say you're the one who is being vaccinated in January. I received my vaccine in April. We know that the antibodies based upon a vaccine decline in between 4 and 6 months' time. We both go to a festival in August. We both have a vaccine passport.
Mm.
Your antibodies will probably be totally diminished by then, and I will still have some. So what's the use? How will you how you will control this? Yeah. First point. Second point, vaccines don't help fight the fact that you can transmit the disease to another. So this means if you're stuffed on a plane with 180 people and you're all wearing face masks or not, or all vaccinated and all passports, and one of them has some symptoms, he can still spread it amongst everyone on the plane. So why a vaccine passport? There is no biomedical reason to impose a vaccine passport because it's useless. There are so many variables that you can't control. The vaccine passport can't control the virus. It can't control the spread. So why impose this? Is our feeling, and it's mostly also my personal feeling, but a lot of colleagues share the same feeling, is that we are going towards a more totalitarian regime in which the vaccine passport, or which is called green pass now, because the EU sensed amongst the population that vaccine passport was a nasty word, so they changed the name to green pass. Probably that it won't stop there. Every time as a society, when you give the opportunity to the government to impose stricter measures, that's a part of freedom you lose. And history learns us every time as a society that we give the opportunity to the governments to impose new measures, they will never be retracted. No, they are being used to build upon. So this green pass won't stop there. The next thing is that your socioeconomic status will be coupled with your green pass. And then we end up like a Chinese system with social credits. Then is the societal question again, is this what we want? And that's my fear, that the COVID crisis now is being used to implement several strategies that have nothing to do with the COVID crisis.
And how is that going in Israel? Because in Israel, they implemented the green pass or the vaccine passport, right? So do you have any idea what the results there are?
Yes, indeed. I have connections with researchers there, and indeed it's been implemented. And if you don't have a vaccine passport, you cannot go to a fitness center, or you can go to the beach, or you're prohibited for many things. So what is very strange in a country like Israel, knowing its history, they are basically segregating themselves now within the population. So they are segregating the people who have a vaccine passport and people who, from an intrinsic view, say, I don't want a vaccine. They are being put out of society, put aside. So I don't know what they think. They have a bad history. Israeli people, they were quite misused during World War II. This should have been a lesson for them, and they're the first country to segregate themselves. I can't get my head around that.
That sounds like a very sad paradox.
Indeed.
Yeah.
What about the situation in India, the current outbreak that happened recently in India? Do you have any information on that? Because it was strange.
Yeah, I follow India quite closely. Okay, let's start with some research, with some scientific evidence published in The Lancet. I think November 2020. What did researchers do? They went to Uttar Pradesh, went to Mumbai, big cities, and started doing serological testing. So they took blood and analyzed if people had antibodies or not. Now, you have to know that about 63% of the population in India lives in poverty. 35% of them live in slums. And of those people, 25% are analphabetic. So they can't read, write, or speak properly. In other words, if you look in the slums, they went to Mumbai. Mumbai is inhabited by 20.5 million people, which is twice the size of my country. And they went into the slums, did serological testing there, and did the same in the well-off areas. Let's say the caste system you have there, so the rich people, and they did serological testing there. The rich people are educated, are following the guidelines. The people in slums live with an intergeneration, like 4 sorts of people together, let's say from babies to the grandmother, and all in between are living together in small confined places of 25 square meters. The rich people live in nice houses and are able to follow all the measures. And they do so. What did we see? July 2020. People in the slums already had a herd immunity of 55%. And the infection fatality rate was 0.07%.
That's a lot lower than
That's
the
very low.
0.23 from the.
Okay.
Wow.
Yeah.
Wait a second. Then they went to the good areas with the rich people, did the same serological testing. What did they see? Herd immunity of 16% and an infection fatality rate of 0.27%, which is 4 times higher than in the slums.
Wow.
Okay.
So
what happens today in India? India has a population of 1.3 billion people. Listen good. Listen carefully. 200,000 people have died. Okay? Belgium has 11.5 million people and 24,000 people have died. So what we see now in the news, and that's what's wrong with the whole narrative worldwide, they always use infections as a base to build upon to enforce measures and lockdowns. Infections are the worst parameter you can have, because it's not because you have a huge amount of infections that you see an exponential rise in mortality. No, infections are part of the solution. Give you an example. If we, in Belgium, it's a very small country, easy to implement. That's what I say from August 2020. Vaccinate the 30 people with underlying diseases. Protect them. How do we protect them? By giving health promotion campaigns within the healthy society, healthy, active society, how to deal with people with underlying diseases, how to protect them. You don't have to confine them, you don't have to isolate these people. No, they are free to go where they want, but they discuss with their doctor what the necessary measures are needed to be for them to participate in social life. The 70% healthy community, you can say to them, this is the way you treat underlying people. This is the way to handle people with underlying diseases. Okay, so if you are able to vaccinate 30% and you release the virus within the 70%, then the 70% will reach herd immunity within 3 months' time. And based on the latest mutant. Because we know that 80 to 90% of these people won't even develop symptoms or mild symptoms. So I think that's good, and that's ethically totally responsible to say, give all these people, the 70% of the people, the chance to get infected, then they have a decent immunity. The immunity for natural infection is 8 months up until a year. And your T-cell immunity even goes probably for a couple of years. If you are vaccinated, your antibodies start to decline after 4 to 6 months. So if we had done it from the beginning like this, then we would have been out of this mess a year ago. So now we are being pushed away from the virus in every manner. We can't, they don't allow us to get in touch with the virus. So then the only solution left is through vaccination. But this takes a while, and we all also know now that it's been built upon a genetic structure from 8 months ago, so it's not efficient anymore, and you get contact with a new mutant, so the antibody response won't be optimal. So then you have to go for a second vaccine, a third vaccine, a fourth vaccine, always 8 months behind. So it doesn't solve the crisis.
Right, and the issue I see, and maybe you can comment on that, is that you constantly are exposed to vaccines that haven't gone through any long-term safety protocols. And do you have any idea how much time do you need to actually test vaccines for safety in a proper way?
Well, studies have been done on SARS, MERS, and RSV. For those three, it's also an interesting story. They are genetically, for 98%, the same stem as SARS-CoV-2. They tried, when the viruses in 20 years, 15 years ago circulated, for SARS, MERS, and RSV to develop a vaccine. It took them more than 5 years to obtain basic data telling them that the researchers not to put the vaccine on the market because it had too many complications.
So
now,
we
have the SARS-CoV-2 vaccine developed in 8 months' time, and suddenly it has a 98% same genetical structure as what I said before, SARS, MERS, RSV. Now suddenly it's possible to have the development of 8 months' time, and there won't be any consequence. I can't believe that.
So what I generally hear is that the reason why it's so fast is because there is such a close and cooperation between a lot of different scientists and pharmaceutical organizations. So does that make sense to you? Because so many people are involved. Yeah.
Partially it does, of course. You know, if that's true, I think that this will have helped to shorten up the period of development. But on the other hand, it doesn't change anything on the follow-up period you need. you can develop a vaccine in a very short amount of time with a lot of people, where it normally takes a few years. You can get one, okay, in 8 months' time. The thing is, the follow-up period, we didn't have it. And that's what we need, normally 5 years, to have some kind of basic data to check upon what the adverse effects or adverse responses could be. And we don't know. We basically don't know. What we know now is that we have to wait upon the end of 2023 to get the first data from Pfizer.
So I have a question about the whole vaccine part. You have personally not taken the vaccine, right? Or no? Right. We were actually, as foreigners here in China, we were offered to take the vaccine here, but it was out of free will, only out of free will, and we would be able to sign a paper. I have not taken the vaccine because of the things you mentioned. I believe the same things. I don't believe it's necessary to take a vaccine at the moment, but at some point when we travel, we'll have to take a vaccine. What would your opinion be at that point? If, for example, you want to travel to another country, you will have to take a vaccine. Would you take one, or will you avoid it in some other way?
Well, if you only have the option between a vaccine and no vaccine, well, up until I will wait for another 3 years. I don't need to travel. If we are talking to each other on a huge distance from Belgium. I mean, why should I travel? If you want to take the risk, go ahead.
Okay. And that's a little bit our issue because, well, our families live abroad.
Yeah, so we have to travel out of China, but
Yeah.
My family partially also lives abroad. These are the consequences that you take or you don't take. It's something that you have to decide individually what you want or what you don't want. But as I said before, there is no biomedical reason to enforce these kind of measures because you're not sure that A, you are protected, B, you can still transmit to others. So what's the use of implementing or enforcing a vaccine measure?
Right.
I can't
Right.
get my head around it. We have a case now in Belgium. It's a good one. Last week, a nice example. 20 students from India came over to study nursing here in Belgium. They were tested before leaving in India. They had to stop in between, I don't know in which country, were tested again, were negative. Came in Belgium, and 7 of them tested positive.
Is that the difference in testing, or how does that work?
We also know that the PCR test is not reliable.
Ah, yes.
So what are you going to do? Here in Europe now, they suggest, okay, you can travel. Or either you have a vaccine passport, but even if you have a vaccine passport, you still have to get tested. So what's the use of a vaccine passport? I don't know. So, and if you leave with a PCR test here and you come into the other country, you have to take a test there once again. So, and if you test positive, what will you do then? Because we have a certain percentage of false positive results in PCR tests. So how reliable is all this? I don't know.
So I think there is a lot of confusion still about the whole PCR test protocol. Like, how does it work, and why are they not reliable in the first place? Because I often still hear people and they don't know. Could you, for those people, could you explain briefly, like, how does it work, a PCR test, and why is it not reliable?
Well, first of all, a PCR test is a specific test. It's not a specific test for SARS-CoV-2. It's a specific. So it can trace any kind of viral load. From other coronaviruses, for SARS-CoV-2, for influenza viruses, it can respond on many viral parts. What does the test do? You take the genetical structure of the potential virus that they took from your swab, and it will be amplified for in between 40 and 50 cycles. So this means the genetic structure will be enlarged 40 on average 45 times. This gives you about 3 trillion genetic combinations. And within the genetic combinations, you can start searching for the viral part that might have infected you. The thing is, if you go over 27 to 30 cycles, you can find all infections. You will encounter all infections. If you had an infection with a coronavirus, let's say a year ago, it will still test positive. If you have been in contact with influenza, it will test positive, even if you don't have symptoms now. So what most labs in the world do is they use a 40 to 50 cycle rate. And then you can find anything. Even if I sneezed on a plant that is in my room a year ago, and you would take a swab of the plant and you put it into the machine, it will test positive. So there's the first thing what goes wrong. It has been published several times now that we can't exceed the 27 cycle thresholds.
Is there any place that actually does that uses the 27 or even below that?
That's a huge question. We don't know. We asked here at the local government to inform us about the labs and in which cycle thresholds they are doing the tests, and we didn't get a response. So some lab technicians took pictures with their mobile phones of the machines and sent it to us. Most of them were in between 42 and 48. So you get a lot of false positive results. So if we would follow science, which we know now, and they did blood. It's also a paper, I can't remember, it was Nature or The Lancet that published a huge article in which they took serological testing, blood samples, which are most accurate. And then they did the same, in the same population, they tested with a PCR test. And so what did they saw? If you surpass a 27 cycle thresholds, you get an enormous amount of false positive results. So the conclusion was, if you pass 27 and you see a positive result, you should combine it with a serological test as well to double check if it is a positive result. But most labs still use above 35, 40, 45 cycle thresholds.
So speaking of infections, like in India right now, because of the spike in cases, do you think it's because of the PCR test being used in the way it is, the way you're describing, over 40 cycles, or?
No. I think there is a mutant virus going there or traveling around, which is called now the Indian variant, which seems to be much more infectious, but you don't see a mortality increase that is exponentially following the same line as the infections. The infections are really going steeply up, but the mortality rate isn't going steeply up. You know, they lose about 2,000 people a day on a country of 1.3 billion people. But the infection rate is enormous, which is, in my opinion, good news. And what they also see, and it was published in the Hindu Times, yesterday or the day before yesterday was an article, and it also stated that the most casualties now are to be found within the rich people, not within the slums. Those are already those people already have a huge herd immunity, but the mortality is amongst rich people, which isn't surprising because that's what I was being warning for since August 2020. I then also predicted a second wave. The letter is still online, so you can still check. I then projected a second wave with a higher mortality rate. And it's quite normal, because if you take a population and you put them under control, severe control, for a year with over-hygienic measures, washing your hands, wearing face masks, all the if you go to the shop, everything's clean there. If you take a carriage, it's been cleaned. Everything is being totally sanitized from top to bottom, all day through. We are killing our immune system. If we add to that we know that anxiety, depressions, all diminish our immune system as well, suppress our immune system. This is science. It's no joke. So if you have the combination of all these over-hygienic measures, psychological distress in a lot of people, then you have a deadly combination of suppressing your immune system. So it was quite logical that in the second wave, we would see much more people die. And that's also what is happening today. The more we are in a vicious circle, because the governments keeps us away from the virus, keeps strict measures through which our immune system keeps going and declining. And once we are hit with a virus, even if it's starting to become less mortal, we will get more people that become sick, at least sick. So and that's what we see now in India as well. The people that are severely sick or enter as a death in the COVID statistics are people from well-off areas.
That's very
not
interesting.
People in the slums. And that's what happens now in Belgium as well. They say to us, the experts, we have to keep the strict measures and the lockdowns because we see younger people of age coming into the hospital, where they used to be 85, 80 plus. They are now 65. And I already projected that we will see a decline in age. The next wave, it will be 50 and 40 years old. Because if you put people under over-hygienic measures and stress for such a long period of time, then the active, healthy population will start having the same effect as the weaker people, namely descending immunity levels. And then you're prone to get the infection. And then you are prone to develop a severe form of SARS-CoV-2 or COVID-19. And then you are prone to have more collateral deaths. So we are inducing mortality with this system.
So, Sam, what you just said about fear, stress, anxiety, it suppresses immunity. So if we take that into account, and let's say, since you're into public health, do you have any message for people that maybe they are fearful, but let's say they want to improve immunity or improve their immune system? What kind of suggestions or advice do you have for them?
I think we have to take it on a higher level and try to discuss with governments how to deal with this in the next 6 months. The next 6 months will be decisive because in most countries, you're on another part of the world, but here in Europe, we have a summer ahead. In the summer, we know the virus is also seasonal. We also know that there's a climate influence on the virulence of the virus. So here in Europe, we will see a decline in the next few weeks because the sun is there. We know UV light is very bad for the virus, and also rising temperatures. Dry area with high temperatures kills the virus. So the next window of opportunity is now. And what governments should do now is to start, instead of using a fear-based narrative, is to have a positive-based narrative, consisting out of health promotion activities. Let's say, stop wearing face masks as a start in open air. This will already have an enormously liberating psychological feeling for a lot of people. Tell the people, inform them correctly that we know now that face masks are useless in an outdoors environment. Give the people the chance of participating in social life without the enforced face mask. This would increase psychological well-being from day one. Then the other thing is to ask people to start moving again, because we have been confined to a stay-at-home policy in which people didn't sport anymore, nobody went cycling anymore, nobody went jogging anymore, everybody stayed at home for more than a year. So give people the opportunity and stimulate them to start doing sports again, because also that increases your immune system. Give the opportunity and not only the opportunity, but advise people to help them live a healthy lifestyle. We are putting millions and millions of dollars and euros into keeping up these strict measures, invested in people, helping them to buy healthy food, give them the opportunity to buy healthy instead of processed food, give them the support people also in engaging in social activities, because as a human being we need social activities to feel comfortable and to feel good as well. So we have to invest in these positive sides and not in the fear-based mongering. And then we will end the year or the end of the summer, people will feel better again, and then their immune systems will react much more and better than they used to in the last half year. And if the new stems of the virus comes above in September, October, we won't have this huge risk of gaining another percentage of younger people dying from COVID-19.
And that's basically the point. So we prepare our immune systems to such an extent that actually we can deal with the virus like our bodies are supposed to do, right?
Indeed, that's a good conclusion.
Yeah, right. Okay.
I have a question. Did you hear of this terminology called technocracy?
Yeah, that's indeed what we're facing now with all the experts deciding policy, and the politicians, they don't show up anymore. They just comply to whatever advice they get from the experts. Yeah, there's a technocratic system we have all been pushed in the last few months and years. Yeah.
Okay.
Now, what are the consequences if people that are specialized in one field only, like let's say immunology or virology, what would happen long term if those people would actually, because they're sort of politicians right now, right? So they have a lot of influence. So what will that, I don't know, do for our future?
Then I'm afraid we're heading for a fall. Yeah, major in every way. The thing is, and this is what strikes me so hard in this crisis, is that this is the first crisis not being run or managed by public health experts or crisis managers. It's the first time in history that people with a hyper specialization are in charge. And with all due respect for immunologists, virologists, those are experts in their small field, but they don't see the total picture. Their focus is only on the virus. They are not trained to look in a broad perspective, contextual perspective, or a helicopter view to the situation. And in previous crises, public health experts were managing crises. Why? We are trained in epidemiology, biostatistics. We are trained in global health. We are trained in diseases. We know we have a bit of knowledge of everything. I don't call myself an expert. I'm a generalist. And what I would do, and a lot of my public health colleagues around the world would have done, is to bring together all the virologists, immunologists, economists, politicians, people from society, and you bring them together. And then you go and look from what's the infection fatality rate, and how can we deal with the infection fatality rate without harming economics, and the total helicopter view creates a risk-benefit analysis, which has never been made.
Yeah, and everything is connected, so that's really important. Yeah.
And if you don't have an overview and you don't connect all the dots, you don't get to a decent solution. And that's what's happening now. The only focus is infection rates. But infections are part of the solution, not a problem. So if you keep your focus on the wrong ball, you will never make a goal.
So what you're saying about infection rates, what I've also noticed is that, I mean, every year we have to deal with the flu, right? But now I've seen statistics pop up that actually say there is no flu, there's only COVID. Like how do you interpret that?
Flu has disappeared.
Yeah.
There is no flu anymore. What are you talking about?
Yeah.
Well, if you look at the statistics, you talked about an infection fatality rate of 0.23, which has already been changed now. There's a study being published 3 weeks ago, also by Professor Ioannidis, who did a total new recall on all the data in the world, contacted all his colleagues, and based on serological information, we are now on an infection fatality rate, and it's being published, peer review published. It's been now set back to 0.15.
0.15. And because a lot of emphasis is placed on the elderly, right? So even if the IFR is very low, yeah, but what about the elderly? I often hear. So do you have any infection fatality rate just for the 60 plus or 65 plus or 80 plus?
Well, under 70, it's a 0.05% chance of mortality. Above that, it started rising exponentially. But it's not strange. We have seen this with influenza as well. I used to work myself in as a tutor for personnel working in care homes. So I know the care home situation very well. And every 3 years, you saw a peak in influenza, which is normal. Every 3-4 years, you had a bit of an outbreak, an endemic outbreak of influenza. Then we also saw people dying in care homes, but nobody said anything about it. It was part of life, and these people were never tested. And I always say, when I teach or when I do lectures on the topic, I always say, I went to my grandmother with my children who were still small, and they had a drippy nose, and they had some kind of cold or a coronavirus. And we went to grandmother, and 3 weeks later, grandmother was dead. There wasn't a physician who took a swab back then in any person that died in a resting home to check if it was influenza or not during an influenza period. It just wasn't checked. Their death cause was always natural causes. Nobody ever thought of, during an endemic or pandemic influenza season, to check these people what the real cause of death was. Nobody did that. So it was all natural causes.
So when there's a peak every 3 years, like you said, how does that affect the ICUs? Because like that's what you constantly hear, the pressure on the hospitals and the ICUs. How was that during specific or certain flu seasons? Was that also similar?
Yeah, always the same. I can only relate to my own press here because I don't know your press, but I always say to people, type in Google the titles of the newspapers here in Belgium, 2014, 2018, what we call intensivenzorgen, ICU, and influenza. And you will see all the newspapers talking about the fact that flu patients were on the hallways because they didn't have enough room to put them on the ICUs. People died there. Doctors, nurses were already complaining years ago that during pandemic flu seasons, they couldn't handle the patients. So this is nothing new. I don't have data on Asia. I have data on the EU. To give you an example, in 2012, Belgium had a saturation rate on ICU in a standard year of 81%. Non-endemic, non-pandemic, in a standard, usual year, our ICUs were always full for 81%. So that means standard 81% occupancy rate means that you just have a small limited margin if something happens to help out with an ICU. So what's the case? Is COVID a problem, or is the underfinancing on worldwide global healthcare too limited?
Yeah, and has that changed the last year? Because it seems like enough time to.
On the contrary, it has worsened. In Europe, for instance, we had an enormous amount of hospitals that have been squashed away because it was too costly. So since 2012, when we already had in Belgium an 81% occupancy rate on ICU in a standard year, we already lost in this small country about 20 hospitals. So the ICU beds have declined in the meantime as well. So the problem isn't COVID. The problem is that we don't have enough ICU beds and not enough personnel to handle the crisis.
Right, and that's what you keep hearing about. Yeah, the pressure is increasing, and we need to relieve the pressure.
Yeah, but if you want
Yeah.
to relieve the pressure, then you have to invest in healthcare, and that's what has been neglected in the last few years in most of the civilized countries. Due
Right.
to the economic crisis since 2008, 2009, the banking crisis we had back then, since then all governments have been trying to make ends meet, and healthcare is always under pressure.
Mm. Right.
So speaking of healthcare, do you think there will be a rise of cases again worldwide of COVID, and so that healthcare will have to step up and do a better job this year?
That's also a very good question, because I proposed the reverse protection in August 2020, and now my fear is that we have surpassed the window of opportunity to implement this, because we have weakened our population so hard that even youngsters who will get infected sooner or later might develop more severe symptoms. So we are basically turning in vicious circles now.
Oh, okay. So closer to the end of the year, closer to like September, October, there might be spikes again, right?
There will be a spike, is my projection. It won't be as high as it used to, because what we see in the mutant viruses is that they are becoming less mortal. The infection rate is increasing, but the mortality isn't. So it's becoming more and more of an endemic virus. And I'm not the only one saying this. There's also been in Nature. In Nature Medicine invited more than 100 immunologists and virologists worldwide, and asked them how they thought that the virus was progressing. And they also project that towards the end of the year, it will become more endemic, so less mortal. But I still fear we will see another rise, due to the fact that our population immunity level is so low that it's basically impossible not to get in. When you get infected, that it's basically impossible to be an asymptomatic patient. You will have some symptoms, which we didn't have last year, when we still had enough immune response naturally. So I think we will see, this will be the last time we'll see a bigger spike. But as time progresses, the virus will become more endemic. So I guess in 2022, I think we might see that the virus
slowing down
will still be very infectious, but mortality will be very low. And that's my fear, because all governments and all international organizations are not looking at mortality as an outcome. They are looking at the infections as an outcome.
And yeah, that's what I've been seeing a lot here. If I think you also, Tim, like now I get news articles pop up in my news feed in my mobile phone, and 1 case, 2 cases detected. Like, like we're talking about a few cases, and it just baffles me in a way. I don't know what to think of that anymore.
So
yeah, just to keep the paradigm going.
Yeah.
You know? Infections, you will always have more infections than you will have mortality. So it's better to use infection if you want to keep people in distress and you want to keep them following your measures. Then the best thing you can do is do a lot of PCR tests. Keep on testing again and again, because if you have been infected today, you will still be positive in 6 months' time. So if you will be tested again in 6 months' time, you're a new case. But that's a problem. Today you are tested and you come in the statistics. In 6 months, they will test you again and you will come in the statistics. So they say, it keeps rising. So all the double ups and all the triple ups of people having been tested quadruple times are all added to the already existing data. So you can keep piling up, and you can say, look at the infections. People are infected constantly and everywhere. And then you get huge numbers, and then you can keep the fear-based narrative going.
Is that the reason that, because I've heard several times in the news that people have gotten infected twice?
Sure, of course.
So that's the reason. So they tested positive later due to a PCR test with.
It's very, very strange. This is the first time in history we didn't stop counting at the 31st of December. Every year, previous year, for 100 years, all mortality cases from all causes or even specific causes are always stopped counting by the end of the year. This is the first time they keep counting throughout 21 as well. They didn't stop counting in the end of 2020. No, they just keep adding 21 above 2020.
So now we cannot distinguish between the 2 years. So if we are progressing, like let's say it's the end of 2021, like, I mean, will there be data? Will there be a way to distinguish then?
Yeah, you will scientifically you will be able to do so, but the thing is, in the minds or the perspective of the mass public, it just keeps piling up. You know, why didn't they stop counting the deaths or the mortality in the end of 2020? Now they can shout, we passed 3 million deaths. No, we had 2 million deaths in 2020. And what do we have now in 2021? But just keep piling up. So the numbers keep aggravating. If I would say, I said to you before, 65 million people die every year of all kinds of lifestyle diseases. If I would add this for the last 100 years, then I could say we already lost 6.5 billion people. Hey, I won much more precarious than COVID. Come on,
it seems kind of silly if you look at it like that, because the amount is just so massive. Yeah.
The same with influenza. From the data we have from influenza, yearly we lose about 650,000 people. In an pandemic year, it even rises up to 1 million. But the flu is here since 1918 because it's a variant of the original Spanish flu. So if you count backwards, and let's say we keep it to 650,000 people, which is an underestimation, because there has never been tested so much on influenza as we ever did on COVID. So probably the 650,000 is still an underestimation. But let's keep it to 650,000 and you multiply it with 100. That's what we lost in the last 100 years, basically, on influenza. Okay, that's a bit of a caricature because you have to take the total population into account. Also 100 years ago, which was smaller than now. But basically, if you think about it, we lost millions and millions of people on influenza throughout the last 50, 60 years. It must have been 30, 40 million.
Yeah.
So do you think it was just profitable to count up numbers up to 3 million? Was it profitable for certain people or certain organizations to go that way, or?
I think we cannot deny that we all know that pharma lobby has been there for a long time. You know, they even have licenses within the EU. They are allowed to contact members of parliament directly. They have a lobby group. They sit together with policymakers. It's an official institute by itself, you know, and so it's all intertwined. So you can't tell me that there isn't an influence. Of course there is.
And I've heard, Sam, that the pharmaceutical companies, they cannot be held liable for any potential vaccine damage or any side effects that occur as a result of taking a vaccine. Is that true?
It's what I can tell is it's true for Europe and it's true for the US. So they have a liability waiver and they got it from the European Medical Agency, and the FDA in the US also gave the liability waiver. So they don't have a liability. If anything goes wrong, their hands are clean.
So that just seems odd to me, and like I cannot really comprehend that, because they're the companies that develop vaccines, right? But they cannot. So if you cannot be held responsible for your own product, Like that doesn't make sense to me. Like that.
It doesn't make sense at
Yeah.
all. You know, if I start creating a toy for children in between 0 and 3 years old, and there are loose parts on it, I know it can. The little child can swallow it or even suffocate on it. You know, if I do something like that, I will be in jail immediately.
Yeah, exactly.
For millions of people, and you have a liability waiver, nothing can happen. I don't know. You should explain it.
Yeah, this is something to think about, I think, and for everyone.
We actually watched another interview that you did, and we heard you say that the governments they get that there is a financial support during lockdowns, and that was a very interesting thing I noticed, and I was like, I really want to ask this question to you um, about this whole financial support. Like, can you explain a little bit more about that?
Well, it was publicized by the International Monetary Fund itself that countries that implied or imposed a lockdown would get financial aid. That's how they put it. You get financial aid. And why? The reason is that because due to the lockdowns, you basically create an economic crisis. So to counter that, and it sounds logical, you get money from the IMF. Now, which is, of course, in our Western society or Europe and the US, let's take them together, it's a neoliberal capitalistic model. Has been flat broke since 2008 and 2009. We have countries in the EU like Spain who have a deficit of more than 140% on their gross product. The same in Belgium. We have a deficit of about 120% now on our gross product. So all these countries are basically hanging on a thread. We're all flat broke. The only reason why we are still alive is because the European Central Bank is printing money on daily basis. So we already had about, I think, 6.5 billion euros being put into the European economy without, it's just being printed by the ECB. So this means that all those countries benefit from I can imagine if I would be a government, it's beneficial for me to implement a lockdown because it brings in more money than I could raise during the economic period of the lockdown. So it's a good investment. Lockdown and you get free money from the International Monetary Fund.
Yeah, I've been getting mind fucked a lot. Thank you, Sam. It's like, yeah, it's unbelievable, actually. Yeah.
Okay, so I'm wondering, every single person has a motivation in life, right? So, what is your motivation to do things the way you think, the way you say things? Like, what is your motivation? Could you tell us?
I started doing research on the topic March 2020. The two things I was involved in when I was in the UK studying public health and doing research on public health were health inequalities and viral transmissions. And since March 2020, I realized that the narrative I saw the first IFRs, which were quite high, 4.3% for SARS. But I knew in relation to SARS, MERS, and the other Nipah and H1N1 that we had, those mortality rates were much higher. So I was like, something doesn't add up here. And that's why I started investigating the crisis. And the more I went through the crisis, the more I saw that this would have a devastating impact on society, but children in general. And not only here in Belgium, but worldwide, which has already been confirmed by Oxfam now. But
and how big of a part do your own children play in your motivation?
Important. See what's happening to them. I have the best friend of my daughter. A month ago, the mother found out that she had a knife and a towel under her bed.
Oh
See,
boy.
it was full of blood. So she didn't know what happened. And she talked to the daughter and she stripped up her sleeves and she showed her arms, also mutilation. She's 16 years old.
Oh,
This can't continue, okay? So
yeah.
this total shit has to stop somewhere, and we have to put everything in the right scientific perspective. And that's why I keep fighting. This is not a society I want people to live in, and this is not the reason why I have children. I brought my children on this earth to have the potential, or at least the opportunity, to build an own life, and not to be regulated by a government.
Mm.
They have to develop their own life. They should be able, as an individual, to develop on a normal, as far as normal exists. And this is made impossible now. I don't want to leave this planet without putting up a fight for this.
So that's very admirable, Sam. I do feel like we do all need to consider this, because if this continues in this way, I also fear for the worst. But I am positive that more and more people are opening their eyes on what's happening, and I do think that people like yourself, you make a great contribution, and show people that there's still a lot to consider. Yeah, and like what you just said, brings me to the following. So your plans for the coming year. Do you have any specific plan you can tell us about? Because you're going to continue on this path.
Yes, I certainly will. The next step I will take personally is to start writing a new policy recommendation, because I think my initial suggestion has surpassed this window of opportunity. So I want to write a policy recommendation that can be used for governments, and I won't write it alone. I already discussed with a lot of other people that will help me out. But we want to do a policy recommendation, as you said, based on health promotion instead of fear promotion. Giving guidelines to governments and people how to handle their immune system, how to build up their immune system, what vitamin C, vitamin D can do to improve your health, what health food can mean to you, what sports and anything that gets your exercise going can help to stimulate your immune system, how you can deal with psychosocial stress, to alleviate a part of the problem, so that we are, as human beings, able to cope with the virus when it hits us. And now we are basically sitting ducks, or becoming sitting ducks.
I think this is very important to realize. And for any critics out there, I think what you're suggesting is a very positive but proactive and constructive approach.
I think people need connecting again. We also have a huge polarization now. People who are, let's say, conscious about what is happening, and the people who are so indulged in the fear-based narrative that they don't see anything else anymore. And this leads to a polarization. You get pro and con, and people start fighting. I see families breaking up, friendships breaking up, because someone says, I doubt what is happening. The other one says, you're stupid because you don't follow the experts. People get into trouble on family level, individual level, societal level. We have to stop this. What are we doing as a society? People should realize that what we are doing now is we are starting to fight amongst each other instead of against the virus or against governments. We are fighting amongst each other. Let's reconnect, have a positive message, go forward, try to develop a good, healthy lifestyle, try to reconnect with people you used to and which you didn't in the last few months, and try to we need to have it's a moral duty to stay optimistic. We have to. That's the only solution out of this problem.
I think that's a very positive and encouraging message, and I hope people will take it to heart, and we for sure will, right, Tim?
Yes.
Yeah.
Yeah. So, do you want to talk about Collateral Global and Great Barrington Declaration a little bit, so the audience who's listening can understand a little bit about both of these organizations and tell us a little bit more about them?
Well, the Great Barrington Declaration proposed the same thing as I did. I wrote my letter in August, and they came up with it in October, but even more scientifically underpinned than my letter was. It's been the open letter was written by Professor Sunatra Gupta, who is an epidemiologist from Oxford University, Professor Martin Kulldorff, who is a biostatistician and an epidemiologist from Harvard University, and Professor Jay Bhattacharya, who is an immunologist and a professor at Harvard Medical School. So, what Beyonce and Rihanna are for the youth are those people for me. I don't even get to their ankles. And they wrote the same thing. We need to go to a reverse protection. We have to protect the vulnerable and set the rest of the society free. That was basically the statement of the letter. And it got signed in the meantime by 15,000 virologists, immunologists, and vaccinologists who support the idea, and another 41,000 medical doctors from other specializations also agreed with the letter, and they tried to bring this forward to the WHO and other supranational institutes, but the response was weak to non-existing. They don't want to hear those people. So I always say, in my country, we have 5 experts setting out a narrative, but those 50, 60,000 other experts claim another story. So why do we listen to the 5? It's the same everywhere else. So I think it's an interesting side for people who want to see the alternative or potential other pathway out of this crisis to visit the Great Barrington Declaration. And the same people now have started up a new project called Collateral Global, which you can find on collateralglobal.org, in which they want to put forward scientific evidence on the collateral damages that we are facing as a society now. Because we're only looking at the virus and the mortality, but we're not looking over the millions of other deaths we will conceive in the next years to come. And we have to take this into account as well. And we will have a lot of all-cause mortality risings in the next few years.
So for anybody who's interested in looking up these sites, I think it's worth it. We put a link in the description, so check it out.
Also, if anyone wanted to connect with you, for example, how could people reach you? Is there a way?
I'm still on LinkedIn as long as I don't post anything. And I'm not planning to put anything forward there anymore. So it's just the touch base for people wanting to reach me. They can through LinkedIn, so that's not a problem.
What about other social medias? Twitter, Facebook? Are you not on those, or?
Well, I'm on Facebook as well, so I post some analysis there. But I also figured out in the meantime that if I do it and I put it on public to share my analysis, then I get blocked immediately. So now I have find a space on Facebook only for my own friends, and I ask them now to copy paste my analysis. Because if I open it up for the big audience, I get controlled by fact checkers, and I don't have the problem if I confine myself to my own friends.
So your friends can share that. They just copy paste and share it in Facebook.
They are the only ones who are able to see my analysis, and they copy paste it and they put it forward. Yeah, those are my.
And what about them? Do they not get blocked? They are okay?
Oh yeah, sometimes they get blocked as well, but I have so many that they can keep spreading. And if 1,000 get blocked, 2,000 are still projecting my analysis, and then when 1,000 from the other group gets blocked, and the other ones are released again, and they can start pushing my analysis forward. So, yeah, it's a great team of a few thousand people. Yeah,
you have great friends. That's very good. Okay. Awesome.
So Sam, I think this is I think we can finish on this part, and I first of all want to thank you so much for being on our show. I learned a lot. I think Tim as well.
Yes, I actually didn't know a lot of the things that you mentioned, and it was very interesting to hear your perspective on COVID and pandemic and all these things that you mentioned are very, very interesting.
Thank you very much for inviting me both. It was very nice, and it was a huge pleasure talking to you.
Okay, yeah, it was our honor. Thank you.
Well, hopefully we'll have you in the future sometime again for another interesting conversation. And
feel free to ask me again. It has been lovely and nice. Thank you.
Great, thank you very much. Okay, we'll talk to you soon then.
Goodbye.
Okay.